here.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. Between the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Okay, so let's stop sharing for a second. So does anyone wanna practice just over here without water? Like see how you wash your hands? Okay, so the first step, so make sure every step is like 5 seconds. And cross the finger. And all your thumbs. So fingertips. Okay. Right. Yeah, so just gonna share screen. Okay, so the next session is how to do the hand rub. Basically, rub your hand with alcohol-based hand sanitizer is the same as hand washing. And the only difference is you just need to get enough of the hand sanitizer, and the same procedure like every time, use the hand sanitizer to rub your hand. So everyone can see the picture over here, and just follow this procedure. Make sure your hands are clean, and yeah. Anyone have any question? No? Okay, good. Right. So even though we all know how important it is to clean our hands to keep germs from spreading, the study shows an average healthcare providers clean their hands less than half of time they should. So do we really have to talk about hand hygiene again? Yes, we need to talk about it. It's very important in our working environment. So and okay, with the share screen, let's share.
No. Yeah.
Okay, let's go through some quiz about hand hygiene. And so who need to practice hand hygiene in a healthcare environment?
All of
Everyone?
the above.
Oh yeah, all of both. Yeah. So true or false, hand hygiene should be performed before and after entering a healthcare environment, healthcare zone, or after a patient room.
True.
True. Answer needed. Too quick. How long should you wash your hands with soap and water?
No, 20 seconds.
So we got two answers here. So is it 5 seconds or 20 seconds?
20?
Yeah, 20 seconds. That's correct. What hand hygiene procedure will help to stop the spread of infection agent?
What hand hygiene?
E and C.
Yeah, A and C. Hand hygiene is important because it protects patients from infection. It protects a healthy environment. It protects me of above.
D.
Or of above. When should hand hygiene be performed if a healthcare worker enters the patient's room to conduct a non-invasive procedure, such as vital signs check?
Always before and after.
Yeah, before and after touching the patient. Okay, so when should hand hygiene be performed if a healthcare worker is about to start an invasive procedure on a patient, such as remove a surgical gem?
Always.
Always immediate before starting the procedure and after the completing procedure.
Yeah, so that's the true or false. Hand hygiene does not need to be performed if a healthcare worker enters a patient's room and touch the curtains, but does not touch the patient.
False.
False. That's right. So true or false, clothing, jewelry, and nails treatments may have infection agents that can be transferred to others and the health environment, facility, and equipment.
True.
True, that's right. Okay, everyone is doing very well. And yeah, thanks for everyone. Let's stop sharing. Okay, and stop